It is. Hey, everybody. We're here with the Dirt Trail Running Podcast, Coffee with Coaches. I'm Coach Loretta, and I'm here with Coach Reese and with Dr. Liesle Elsey. So thanks for joining us today. I think this is going to be a really exciting show. I'm super excited. I love working with Reese and with Liesle. So I'm super excited to be in a room with them and to have some really great intellectual conversation. And today we're going to delve into the topic of maybe looking at the most common niggles that runners may face and kind of teasing that out a little bit. So I think this is a show that you're definitely going to want to tune into, grab some coffee or your favorite beverage, and let's get started. So I'm gonna kind of play a little different than we normally do. And I'm going to start out with providing some of the topics and letting Reese and Liesle kind of pick through this. So our first one is, why do hamstrings lock up after a race?
Yeah, so I think it's interesting because when we think about running, it's our mechanics change as our speed increases. But depending on fatigue, like what happens, and then do we begin to overstretch? And then now we're putting a greater demand on the hamstring. So my hypothesis would be that to finish that race, we're changing the mechanics to try to be faster and get across the line. And that'd be my theory. But I'm curious as to see what Reese's theory is.
Oh my gosh, I am so in line with you. I would say that it is a difference in biomechanics, probably biomechanics that you're not used to using. Maybe you haven't trained those before. Typically in my mind, the easy way to answer like what is that type of lockup at the end of a race or the lockup in a hamstring in general is, you are using the muscle where it's not used to being used and the brain thinks it's in a dangerous place. It's going to lock it down. So maybe we're doing a bunch of training at our low end aerobic capacity because we're training for these ultras. And then by the time we get to the end of a race, we want to sprint it in. We want to look good. You have a little bit more energy. You kind of give it a little bit more juice, but you're under fatigue. You're taking your hamstring to a place that's not used to operating in, and your brain's going to go, oh crap, we're in danger, lock it down. And then you get that crazy calf or hamstring cramp. So that's kind of like my conception about it. Does that kind of resonate with you at all?
I was going to say the other thing too is like you think about step length, right? And so I think as we go longer distances, that changes a bit, right? And so then now you try to speed it up and you increase that length, and that hamstring's like, wow, it's too far, and then it's like, so yeah, we get in a pickle. So it is, but this is why, like, as coaches, giving them some strides maybe after their long run, just to say, hey, hamstring, if you decide to sprint, we can do it.
Yeah, that's what I was going to say from a coach's perspective is, how can we help to prevent that? I think a couple of things that I'm seeing is one, blending in some strides or some tempo type work into a later piece of a longer effort. And then also I think addressing there could be other things going into play, like it could be their nutrition and their hydration, right? Because now you're at the end of the race, you're probably getting low on fuel and hydration and electrolytes, and now you're asking for your muscles to work when they're exhausted, right? And so you're asking them to put in more effort than they had been doing, which they were managing until they get to that point where they try to, put it all out there. So I think also really keying in on practicing in those long efforts, your nutrition and hydration, just like you were going to do on game day.
Exactly. I think the big thing too is that like a lot of us do strides, a lot of us do long runs, and that's great. That's a great first stepping stone, and to progress that to actually hey, when we're talking about training, we're talking about mimicking what we plan on doing at the race. So we all kind of want to, have that sprint in kind of be natural, and it's that's great, but let's make sure that we prepare the body to be able to do that too. So now that you've worked on your strides for a couple of weeks and you worked on your long runs on separate days, maybe it's time to combine them into a similar day. So practicing those different biomechanics in the faster stride while your body has a ton of fatigue, I think would be a great idea for anybody, especially just to remind your body what good fast running feels like after a longer effort,
Yeah. And I think throwing in another variable in some of these long efforts, we may have that goal at the end, but we also may be doing some run walk combination throughout, the event. And so I think, again, practicing that in your training so that your body's ready for that. Okay, I might be doing a 5-minute run and a 1-minute walk, but I want to have a fast finish. How am I going to put this into my training plan so it's a little bit more race specific practice to be ready for race day?
Oh yeah, that's interesting. Yeah, I mean, because like you go from like a run to a walk, or from a walk to a run, it sounds crazy.
Right. So your body doesn't, your body has to be prepared for that. We talk about that a lot on this show that, if you're planning to do some walking in your race, you also need to put walking into your training plan so you're ready to be able to walk both mentally and physically.
Yeah. And I think too, just like we always talk about the transitions, getting your body prepared for the transitions. What does it feel like to go from a walk to a run when you're under fatigue? What does it feel like to gradually slow down from a run back into a walk without just kind of slamming on the brakes, So making those transitions as gradual and as easy on the body as possible too, I think can help, mitigate any fatigue. So that way you can't get to the end and like have that kick into the finish too.
All right. So I like the next one, I didn't read this that carefully, and Reese came up with some of these. So here's a quote from Reese. How can I keep my quads from feeling like dog meat at the end of a race?
Yeah, well, but so this goes back to the mechanics of how one runs. So I think if you bias more of like an upright running pattern, that might put a bit more of a demand on that quad versus maybe having a bit more of a lean forward to kind of access that posterior chain, meaning like your glutes, which are like they're super strong muscles, and then specificity of training of the terrain that you're on. So I can remember my husband had done his first marathon and he didn't do any hill work. And he was destroyed because the course had like rolling hills. And so when he went back to like his next training series, he was like, okay, I need to put some more hills because like my quads were shot. So I think that those are two things just to consider is back to biomechanics, and then also like how you're training for what race, like what is the terrain that you're going to be on? Is it like this or is it more like this?
Would you also have somebody train hills if they were running flat? This is often a discussion with Loretta and I. I just kind of want to hear your thoughts on that.
Yeah, absolutely. Because it's going to give you a bit more power, right? So you have to use a bit more to get up that hill. And if people aren't, so say it's winter's coming, they're like, I'm going to do hill, like training on my treadmill. It's like, fine, put it at an incline because you like, and the nice thing about doing any type of hill work is it changes how you run, right? So you're going to lean up into that hill versus like, you won't run up a hill upright, like you'll fall backwards. So absolutely. I think that if it is flat, it's just going to make them a more efficient runner.
Sure. Okay, so here's kind of my train of thought with like the hills and the strength work to like prepare your quads. Because I feel like most of us, even if we run a completely flat race, like last year I did Hennepin 50 and it was just, it's flat as a pancake. And like my quads were pretty sore. And I was like, there's no hills here, but there's still a lot of like quad work when you're talking like knee flex or knee extension. And just in the running stride, if you're running on flat, there's a lot of quad work anyways. So I'm almost thinking that like when you're running downhill, you have that open hip angle. So you have more extended hips and we're training those quads to work eccentrically that way. And I feel like that's like the biggest abuse maker on the body when you're running flat is that eccentric quad action. Especially as like the hamstrings are kicking in and like the leg is swinging behind you and your quads are kind of like lengthening like this without like letting your heel just completely like rip back into your butt. If we're not running on like hilly terrain, like there's still a lot of eccentric quad work. So why don't we train more eccentric quad work with hills so that way we're more prepared for the flat in the race? You know what I mean?
Yeah, which is interesting though, even like from a perspective of overall, like what exists in the research, for any injury that we have, be it our shoulder, our knee, they say like eccentric, eccentric, eccentric. But that's not always what we practice in the clinic. We're like concentric, 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 because I think that's how we were taught. And so for those listening who don't know what concentric, eccentric is, right? So concentric is like shortening of that muscle. And then eccentric is that lengthening. And it has to be in a controlled fashion. And it's so funny because we're supposed to be research-based, and but we don't always practice the eccentric control. But yeah, absolutely. And even eccentric on like hip rotators too, which that's a whole nother topic.
Yeah, can I take that one step further too? So like when we're talking about training the quads while the hips are in an extended position, I personally do a lot of sissy squats. Are you familiar with that exercise?
Maybe not the name of it, but the motion. Go ahead. Can you show me?
Say the name of it again.
So it's almost like that limbo type of squat where you keep your hips open.
Oh,
A lot of knee extension, which is a lot of quad work, right? But when doing that type of quad exercise, as opposed to like a typical squat, you can definitely feel different parts of the quads working. Like you're not quite getting that like that one quad that works as a hip flexor as well. You're kind of helping the other quads. But I feel that if we're running and our hips aren't in a super flex state, so imagine like the whole of the squat, then is it more specific to train with that open hip angle as opposed to sitting back down into a squat? Not like, a deep squat isn't worth anything, right? But as competition draws closer, can we work those quad muscles a little bit more eccentrically in that open hip position and train them a little bit better for what we're actually going to incur on race day?
right. I think that's one of the things too, like putting your foot on an incline, because that's going to change like relative hip position. So because you think about if you were up on an incline, and then your pelvis relative to your femur, does that make sense? Is just gonna, yeah, is gonna make you, you can, if for those of you who are just listening, I'm using my hand and as a pelvis and a femur here. So it's like, okay, here we are, we go up, and now we're going to be a little bit more extended. And so same thing, just going more from like, instead of top down, going from ground up.
Yeah, and we actually have on our resource library that exercise is on there. So it's squats for downhill running. So if you're looking for an idea for that, it's on there.
Awesome. Yeah. So I think, that's kind of the meat and potatoes of it, right? Is like, did we really train our quads that well? And I think that there's not a lot of people that I give this type of workout to, but it's downhill intervals. You don't need a lot of them, and you don't need them all that frequently, but usually about like 4 to 6 weeks out from a race, I'll have an athlete do 1 to 2 sessions where, we're doing anywhere from like 4 to 5, 30 seconds to a minute downhill, nice and hard. And then we'll do like a small little canter back up the hill as recovery, So that way we can give the quads a larger dose of what they're going to experience on race day. So that way they can adapt eccentrically too. Do you guys, Loretta or Elsie, do you guys, or excuse me, Liesle, do you guys do anything like that? I know downhill intervals are like really kind of a hot button topic these days.
Yeah, I do incorporate it, and depending on really what the course is that they're going to be doing. So especially if they, I've had a few people running Boston or the Marquette Marathon, all downhill, so we wanted to make sure that they're, ready and prepared for that. So definitely I'm putting that in my training plans. Yep.
My realm is more like, right, muscle preparation. So they'll be doing the strength component of, all right, we need to really or like even do like even though like a wall squat, will just put tension across that knee. And that can also be just tension that the body's just not used to.
Right. So we've kind of mentioned a few different movements you can do to get your quads prepared. Is there anything else? We talked about wall squats now, and we've talked about doing the squats for downhill running with a little bit of a incline, I guess, that you would be standing on. What else would you suggest to prepare for hill running?
You can do all your step ups for uphill, but as far as downhill stuff, I mean, those would probably be my go-to. And then I think some practitioners would say even just training from a muscular standpoint of using like a leg extension type of machine to really work an isolated quad function.
Okay. Any other thoughts from you, Reese, on that?
Well, I was just wondering, Liesle, do you guys use any like drop downs from like a step or maybe from like, something like that?
Yeah, actually. So yeah, I do. So I'll have them step up and then drop down. Depending on how cruel I'm feeling, some of them will. I don't think I've had anybody do that in a while. But yeah, I will do that drop down because that's going to be that load, like. But then I'll also so I've done some coursework through Run DNA, and they'll have them do like a box drop to like hurdle hop. So it's like down like that eccentric kind of like load, and then now they have to explode out of it too.
Oh, that's cool. Can you, for the listeners that aren't familiar with drop downs, can you kind of like cue that up for us or, take us through?
So depending on the height at which you want to be from, like even if you're just doing from your steps at home, is that you are going to like step off the cliff, and then you want to be able to like control that landing, but it has to be like visualizing a spring. It's not just going to be a hard land, because it's just going to, all those forces are just going to go straight up through every spot in your body, especially those ones that are can be more vulnerable. So like your SI joint, yikes. So you still want to make sure that there's like this catching motion when you do land, and then being able to, if you were to do a hurdle jump over that moving forward. So it's all about how that cushion is. Yes, is that a fair description?
I've even seen some soccer players use these too, and I think it's a great idea for like trail runners when you have these like hurdles set up either on the front or even, and this is a progression, this is a little bit more advanced, but putting some hurdles on the side too. Imagine how many times, like I know, especially on the kettle course, like where you're going downhill and there's a hairpin turn, so you're not only like decelerating force but also pivoting at the same time. I'm thinking specifically just, what is that? I want to say just north of the Scuppernong loops, as you're kind of like heading out of that direction. So like you kind of like land and then have to bounce to the side while you're, pivoting, rotating, and then loading sideways, I suppose. So
Fascinating.
I think too, doing so, and this is another progression. Once you get really good at that cushioning, like with two legs, and then getting used to cushioning and then rebounding and then cushioning and rebounding in a different direction, now we can begin like single-legged work, because that's like what we do as runners. So you're not dropping down from nearly as high. Maybe you're just dropping down from like, like a fat book or maybe like a fat 2 books worth of drop, but you're dropping down and then kind of popping off of one foot in a direction. And personally, like whenever I have people do drop downs too, like, like first we're just working on like, let's land, let's cushion, and then let's give the knees some time to kind of like readjust and find their center back over the feet, especially while you're sinking into the glutes, not letting your heels and your quads take too much load by having them, translate over the knee or over the feet too much. So, like that's kind of how I always start people off, is just like, let's just like drop and then let's sit and then let's just see what our knees are doing and wait until we get really stable doing that.
Well, and the other thing that's great for too, if you soleus, eccentric load to that soleus. So if you have some type of tendinitis, I know this is not what we're talking about quite yet, but if you have like a tendinitis, like Achilles tendinitis, that is going to, what your soleus is a muscle that sits behind your lower leg bones, your tibia. And so its job is to help control how fast that shin goes forward. And so if you don't do any type of soleus training, which most of us don't, we do our heel raises. Yeah. But soleus training, so its job is to work eccentrically. So then the question becomes like, well, do I have a tendinitis because my soleus isn't doing some of that deceleration, which your box drops will essentially get a portion of that. Or if you don't have that dorsiflexion, which is being able to have that ankle to bend, then you're going to be in big trouble. So that's another like bang for your buck, quad and ankle.
That is awesome. I love that. And I love that talking. Maybe this is a good, like, segue over to like plantar fasciitis, not to steal your moderation capabilities, Loretta, but the soleus, I always tell other people, is kind of like the calf part two. It's like the muscle nobody thinks about, but is not arguably, I don't think, is the most important muscle for running. The calf is really great for those quick explosive maneuvers. Like, let's say you're like trying to like jet up a hill super quick and you're giving it all that you can. Maybe you're jumping over a log or something like that. But when it comes to, just like the standard running gait and running mechanics, like the strength, the pliability, that responsiveness of the soleus is going to be the most important thing by far. So I think, maybe we can talk about plantar fasciitis and talk about some soleus and calf training with that.
Yeah, I was just dreaming about, I am doing soleus work because I work with Dr. Liesle. So I have been doing that. And it's also on our running library. So it's something to look at. I'm sitting on a smaller box jump, maybe 12 to 14 inches. So I'm able to place a large plate onto my quads and working on the soleus. And I'm actually doing both the soleus and then heel raises, kind of alternating between the two of them. So definitely, hopefully that will be a big improvement for me. But so I'm just like, I get a gold star today.
That working the soleus is effective. Yeah, but so when we think about just like a plantar fascial stuff, right? I think this is the debate is whose fault is it, right? And so my journey as a runner was like shin splints, but like I tend to be a very flexible human, and so my feet are very flexible. So that means that I have to have adaptable feet and responsive feet. So I tend to go from the ground up, and don't get me wrong, you can go from top down as well. And so we try to kind of marry the two things. But when we think about a plantar fascial combination, it's like, well, the first thing is, do we have the mobility through the foot, like, and ankle? If the ankle cannot bend, then that midfoot will figure it out, and that's when we'll have maybe a bit more of that excessive pronation. So we need pronation to cover ground. I mean, like that's part of the mechanics of gait. But when it's too much, then does that put too much of a load on those plantar fascial tissue? And then now we have an irritation in the plantar fascia. So I'll start with that, and then we can banter back and forth.
Oh my gosh, love it. The way that, like, I love that question of like, whose fault is it? You know what I mean? Because that's a big one when it comes to the plantar fascia. And I think the way that I like to describe to people, like, what is it and like what type of structures can help like support it? Like when you think about like the human body, if you were to just pick somebody up by a string by the top of their head and they didn't have any control over their limbs whatsoever, their foot would go like this. It would just drop and go flat. So I like to think about the plantar fascia as an extension on the posterior chain meaning those calf muscles and those soleus muscles and those other plantar flexors that are too small to go through the list of right now that are important. Some of them that help invert, some of them that also help evert the foot. So we can just collectively call those like the calf muscles maybe. And then you have your hamstring and your glutes on the back too. So I always tell people that, like if we're going to treat your plantar fascia, maybe we start by doing some some inflammation decreasing activities. Maybe we do a little bit of rolling. Maybe we do a little bit of ice if it's really bad. Most of the time I like heat on that area just because it keeps the tissues warm and pliable and ready for exercise. But then after that, once we can start to like input some more force into the tissue, We want to put in enough force to kind of poke the bear a little bit, but not so much where it's going to get angry and like start talking back at us. But the way that we do that then is by doing like foot isometrics, like squeezes, arches, things like that to work on the intrinsic foot muscles. But then once we can gradually start to work on the soleus and the calf complex, like then we start making a lot of gain as far as like how to fix plantar fasciitis.
Well, and that's toe yoga is one of those fun. Do you know toe? So toe yoga is where you do like big toe up, right? Little toes down, and then big toe down, but making sure that when we're thinking about big toe down, it truly is like long big toe down, not big toe curl and baby toes up. So, and then the other thing to think about is like contralateral, so opposite hip. Are there mechanical issues that's making you land maybe a bit harder on that opposite side? So it's having to take up that shock absorption. And then footwear.
Not go there.
I know some of us have like binkies. But yeah, footwear is like, I mean, that's again another whole other topic. That I imagine, Reese, you and I could probably go on for hours about that.
Let's dive into it. What do you think? Like if somebody comes up to you and is like, yeah, like I have some like foot pains, like sometimes my ankle kind of hurts, like what's the best shoe for me? That's always a question that nobody like that's in kinesthetics likes to hear, because it's like, oh, the amount of factors that are spinning around in my head as to what answer I'm going to give you are too numerous right now. I can't answer all, or I can't ask you all these questions, you know?
Yeah. Well, typically I'll back up. I'll say, well, how long have you had these, have you had these shoes? Are they comfortable? And they say, yeah, they're great. I'm like, okay, well, let's see what else is going on. You know, check mobility of everything. And then it was like, no, I just got them. I was like, well, does this correlate with some of the aches and pains that you have? Somebody, then I would say, well, let's maybe modify what's going on here. So and I will also fully disclose that I'm a more minimalist footwear practitioner. So, and I'll show them, like, look at what I'm wearing right now. And it's like a sock. So, and they'll say, but, oh, well, I have flat feet. I was like, oh, let me show you my foot. It is flat as a pancake. And so it just all depends on how we create an adaptive system. And they say, oh, okay. I said, so if you want to wear something like this, super. If you don't, great. Let's make sure that you still have a system that can shock absorb properly so that you can cover that ground and not have aches and pains. So I always disclaim it. I am a minimalist footwear person and I have flat feet.
And I have no running shoes. I'm down to my last pair of Adizero Boston 9s. I know, an unusual shoe for an ultra runner, but I've wore them in so many long races, my 100s, my 24 hours, and I stockpiled them as long as I could. I'm down to one last pair. I'm desperate to find a pair of shoes that will take their spot.
She might even sell her child for it, I think.
I'm not sure. Riley, Maddie, who should go first?
Love the way that you beautifully put that, Liesle. I think my approach when people ask me is a little bit more frank. I always tell them, you know, like if you have terrible foot musculature and you put them in a dynamite shoe, it's going to be a shot in the dark as far as like if you're injury resistance or not. But if you have good foot development, good leg musculature, a good shock absorbing system, you put dynamite foot into a dynamite shoe and now you're damn near bulletproof, you know? So I think like when people ask me about footwear, it's more like, well, let's talk about your feet before we start talking about footwear, you know?
Yeah. I mean, it's funny. Yeah, no, it's like, it's interesting. I had a triathlete in the clinic and I was seeing her for pelvic floor consideration. So each time she would go to run, she would have more urgency to go to the bathroom. And it wasn't necessarily that, it was more fecal urgency. And she's like, I can't do this. Like I'm competing at a master's level. Like I need to figure this out. And so I had her come in and we tried a lot of different footwear on, and as she ran, and at the clinic I was at, we had a system called Dorsify, which allowed you, they have little sensors on to see, like, one of the things we looked at was ground force reaction. And it was interesting because when she had her Hokas on, those reaction forces were much higher. And I was like, uh-oh. But then the concept, and this is again my bias, fully disclaim my bias, is she can't, the foot is sensory. It's meant to feel the ground and like, is this safe to step on? And so if there's a lot of cushion there, like, then you're like, oh, I need to feel it. So let me just land a bit harder so I can get that input. And so what the outcome was, I said, well, if this is what you want to run in, that's fine, but we still have to work on your shock absorbing system because you're landing a bit harder, which are sending those forces up. And now your poor organs are just like crashing into your pelvis and giving that signal of, ruh-roh, I gotta go to the bathroom. And that means like stat. And so being on a course, right, where's the bathroom? Question mark.
That's interesting because we played around with that a little bit with myself with pelvic health, and different shoes made me more successful in not leaking than other shoes too. So
that was really interesting that you brought in, proprioception and tactile feedback in with biomechanics and how that is impacting the brain and what the brain feels and how it alters the brain's biomechanics to then feel kind of like what it wants, what it anticipates it should be feeling. I think, like when we're talking about footwear like that, like we can talk about how the footwear like cushions our foot, how it protects our foot, how it impacts our stride. But then like the biomechanics behind that is like, yeah, like different footwear tend to make people run differently, right? Like a big, thick impact cushion absorbing heel is going to make you almost want to use it a little bit more. That's interesting. I've never heard that idea about the brain like yearning for this impact or yearning for this sensory feedback and then altering how it impacts with the ground. That's really, I can definitely see that though, because the brain is just this information soaking up machine,
Well, that's what I'll tell people, like, well, and they say, I don't understand what you mean. I was like, well, go ahead, slip off your shoes for me. I want you to go ahead and run across the ground in your bare feet. And they're like, well, that would hurt. I was like, but why would that hurt? But well, because it's just be hard. I was like, not if you have a shock absorption system, like you're going to make that contact. You think about going back when you were a kid, and I can tell you, I never had shoes on when I was a kid, ever. And so like I had trained that system, and looking back, it's interesting because I became a middle school runner and I got good shoes. And then I started having all these like shin splints, all these like aches and pains. It's like, well, I put something underneath my foot maybe stopped working as functionally as it should. So again, like I play devil's advocate in that aspect from the ground up.
Mm-hmm. I love that too. Personally, I've done a lot of running in ultras, and currently like I'm running in both topos when I'm at work and then Hokas when I'm, like just kind of like runner, like I switch back and forth. And I think the best thing that you can do like as a runner is be adaptable both physically and mentally and race preparednessly. I don't know if that's the word, but to be adaptable in all aspects, right? So like I think that, like having that really minimalist shoe, like running in it frequently during the week just reminds me like, oh, hey, like what does it feel like to actually be using my foot more properly as opposed to slamming my heel into the ground. So I kind of like re-up on those biomechanics of how my body typically would like to be running if there were no shoes on. And then when I get into the Hokas, then I try to transfer some of those biomechanics, that shorter stride length, and then get the benefits of having that cushion on. So that way, like I kind of like, I'm thinking to myself, how can I get the best of both worlds? I want the biomechanics and I want the cushion at the same time. But sometimes, just like anything, we got to keep re-upping the brain. Like, hey, remember, this is how we do things when we don't have like, all the padding on the bottom of our foot,
okay.
So,
We talk about adaptability all the time on the show. Maybe it's time for me to become more adaptable with my running shoes.
Maybe.
But I like my binkies. They feel nice on my feet.
there's a shoe out there for you, Cinderella.
Well, I just reached out to Tony, our local running store manager at Running Lab in Brighton, asking if there were any new magic shoes out for me. I haven't heard back, but I'm hoping.
Fingers crossed. Looking up.
So this is really great information, I think, because I think oftentimes, athletes steer towards shoes that maybe somebody that's famous is wearing, an accomplished runner, but they might not always be exactly what's right for you. So I think, thinking about that is really important in some of the concepts that we talked about. So that was really great discussion. So I'm going to just kind of move us on a little bit. We talked about plantar fasciitis. What about your calves? What about when your calves are getting tight after a run, or maybe even late into a run? What's some things that we should be thinking about with that?
So this goes back to the concept of calf strength, like pure calf strength, and that includes like gastroc and soleus, because it's always interesting. And this is probably one of the tests that I have people do is I'll say, okay, I want you to go ahead, do a heel raise. Cool, keep that. Now go up to single leg. And then can they keep that same height that they had, or can they not? And so that just gives a quick screen like, okay, well, maybe their calf isn't as strong as we were thinking. And then generally speaking, if anything starts to fatigue out, it's just going to go back to the conversation we had earlier, like everything's just going to tighten on up. And so in the concept of being able to survive, to cover ground, like we were designed to survive. And so if that's the only way for that muscle that might be a bit weaker to survive is to tighten up, then it's kind of like, well, there you go. You're surviving. You're still moving, but not most efficiently. So that would be my thought as far as, and a lot of people realize like, oh my God, my calves really aren't that strong. How do I run? It's like, I don't know.
I think, like strength and length, like the strength of your calf and your soleus and all those other plantar flexor muscles. But then the length, because like a lot of us do a ton of running on flat ground, and like your foot really isn't like plantar flexing, or like your toes going downwards, hinging at the heel, all that much, as opposed to like if we're running uphill. And even sometimes like people's calves are so tight that like like they can't even really then dorsiflex or bring their toes up quite as much when they're running uphill. So you almost get this weird, like somebody's running up a hill, but their calf or their heels are still like raised up in the air, kind of like almost like they're on their toes, So I think like getting that tissue to lengthen, to contract and relax, like in a greater range of motion other than like what we use in running, can prepare us for any running scenario, So getting people to progress to the point where they're doing calf raises off the ground with good biomechanics. So maybe putting a lacrosse ball or a book in between your feet, so that way you're coming straight up with the heels instead of kind of off to an angle because your medial calves and whatnot aren't firing too well is a good idea. But then progressing that to the point where now your heels are just a little bit lower than where your toes are. So now as you come up on your heels, you're using a little bit more calf length, so increasing the strength that we have in the range of motions of our tissues is going to be great. And I love that, what you said, Liesle, about like, like muscles hardly ever just like blow up. Like you're running and all of a sudden like everything falls apart, like everything detaches and you have to go in for surgery and everything because it just quits. When muscles quit, like the quitting is the getting tight and getting really short and not being able to be used then, because the brain's not dumb. The brain's not going to let your muscle go and go and go until it rips itself apart. It's just going to say like, okay, we're going to make it like almost impossible for runner over here to keep using us by making you hurt so bad,
Well, the other thing that you brought up about length too is like great toe extension. Like, can that toe actually extend? And that goes into the plantar fascial stuff too. So like, and so many of us may have like a really stiff great toe, and it's like ruh-roh, like that you're not going to be climbing any place if that toe don't move. So but nobody likes people playing with their toes.
It's like playing with their toe right now to see if it moves.
Oh, so that's a really good question, because a lot of us have heard a lot about kind of like the bigger muscles and the bigger joints, but like, that greater toe joint is kind of a small one that like maybe people don't know, like, hey, how do I increase the range of motion of my big toe?
Yeah. Yeah, I mean, you can literally like play with your foot and try to bend it back. But even when you do like your calf stretches, put that big toe up onto like the wall or a book just to kind of elevate it. So then you're going to get that stretch through that plantar fascia and see where is it that it breaks down. Is it, in fact, is that plantar fascia a pull from the big toe, or is it a pull from the calf? So riddle me that.
That's great. One other mobility drill that I like, I call them plantar rockers. I don't know if there's like a more technical word for them, but imagine you get down on all fours, kind of in like a tabletop position, like you're gonna do like cat cow or cat camel or something like that. You tuck your toes underneath you, and then you use your arms to kind of push your glutes back and see how far you can get onto your heels. Some people can sit on their heels in a kneeling position anyways, and that's really good for getting that greater toe to do a whole bunch of dorsiflexion. But even if you can't get that far, if you can push your glutes back and just try to increase the amount your heel comes up, but your greater toe stays down, and you feel that stretch in the fascial system, that's a great idea too.
That sounds so horrible. Right?
Reese, don't give her any more ideas for me.
Oh, don't worry, Loretta. I'm writing all these things down that we haven't tried for like our videos. So I put all of them with a big smiley face next to it.
Nice. So I think we haven't really touched a lot on Achilles. Do we have any more that we want to talk about? Like, why is our Achilles hurting after a run?
I think we've kind of mixed the conversation of calf and plantar fascial stuff, and it's just going to be that tissue that's stuck in between. But the other thing that that I know we've chatted about, Loretta, is the concept that our soleus and our gastroc, they are two separate muscles, and there's a fascial system that separates them, but they should be able to slide up against one another. And so as we age, we sometimes lose some of that shearing motion, and that just makes us kind of move a bit differently. But if we can keep that like positive shearing happening, then it's kind of like, well, then that just sets us up for more success.
And I think, that's interesting because, bringing up, aging athletes and tendons and ligaments and the changes that are happening in our body, that's something that I've learned a lot over the last year when we've really been focusing on things. And I think just to kind of put another perspective is that autoimmune athlete and, things that we're discovering. I think Liesle and I have had a lot of conversations about that. I have Hashimoto's, hypothyroidism, and, there is research out there that can impact the tendons. Recently, I discovered that I have some calcification on my Achilles tendon, and that could be a result of my hypothyroidism. It seems to be more common in people with hypothyroidism from the research that I'm, doing. So I think I just want to share this because we do have a lot of people that are listening and a lot of the athletes that we're serving that do have some sort of autoimmune disorder. So I think it's important to be thinking about this, to put the puzzles pieces together, to help you move forward as an athlete as well.
Wow, that was loaded. I love it.
Thing to think about.
That's great. Do we want to touch? I think, this is kind of like the granddaddy of like the running chronic illness, this big scary ITB. Do we want to do that for a little bit before we sign off?
Yeah, I think so. I think that, ITB, I hear that a lot with my athletes. They feel like they have an ITB issue, and what do I do? Now my knee is hurting, it's causing me all kinds of issues. So yeah, let's go with that.
Let's go. All right. Well, so this is one thing to remember, like, what is the IT band? Like, is it muscle? Is it fascia? And so we have to know that the different principles of those tissues. We know that muscle can in fact stretch. Fascia can move, but it can't really stretch. But if we can visualize where the IT band sits and what attaches to it, then we need to appreciate that we can stretch our quads, and knowing that quad, that lateral head, actually wraps really far to the outside of that leg. And so is it our IT band being pulled from the front, from our quad, Or is it the IT band being pulled from the back by our lateral hamstring? Or is it the fact that, so choice C, or is the fact that we don't have great ways to control our internal rotation? So like as our foot hits the ground, our foot collapses, our tibia rotates internally, so does our femur, so it's kind of rolling in. Our glute has to lengthen and then has to be able to explode and kind of push forward. And if we don't have the ability to do that, then does that fascial connection of the glute and then maybe TFL, does that then kind of feed down and give us those pains? So like the question always has to be, in my opinion, through the why. Well, why is this happening to you? And then seeing, okay, is it quad? Is it hamstring? Is it hip in the glute? And then the other bizarre one could be if they had like a lateral ankle sprain. And now that fibular head is in a funky position. So 4 options. That's my take.
Another loaded, like, it depends type of answer. Like, who are you? You know, like that's not like the cop out for like PT or for any type of rehab in particular, but that's the level of analysis that we're dealing with where we're talking with, like a doctor of your caliber, is like, let's get more answers or let's ask more questions as to, I love how you said how that happens to you, for some people too, like, I think generally it's classified as like an overuse. So a lot of doctors, typical doctors, GPs will just say, oh, well, maybe take like an anti-inflammatory or stop running, which is what nobody wants to hear, because you stop running, it feels better. You start running, it feels like crap. And then it's like, well, maybe I just shouldn't run. Running's not for me. It's not something that my body can handle, even though I really want to do it. And that's the answer that we need from somebody like you, Dr. Liesle, is like, let's understand, why is it happening to you? On the whole, if you could say, like, in my practice, I generally see this trend with people, how would you say that, like, generally you treat people with IT band issues?
Yeah, it's gonna be quad flexibility, hamstring flexibility, and then checking out hip mobility, and then making sure that it can like control that eccentric load when we're thinking about running. So it's making sure those, like, if somebody were to call me up and say, hey, my IT band's bothering me, like, what should I do? It's like, well, you can foam roll, percussion gun, scrape that quad, that hamstring, see how that feels. Does that feel better? It's like, well, not really. Okay. It's like, all right, did you stretch out your hips, making sure that hip can actually move inside that socket? It's like, oh yeah, that feels a lot better. It's like, okay, great. So that would be like, again, not seeing somebody like, well, why don't you try these things, see if that clears it up. And if they're like, oh yeah, that was it, it's like, easy fix.
Yeah, I love that, like, work around the IT band and not the IT band itself, because I don't know about you, but like, people will always tell me, yeah, but when I foam roll it or percussion gun it, like, it feels better for, like my run or whatever. And then it just gets tight again,
Yeah.
Like, I think like my concept of like the IT band is, it's like a game of tug of war, except, like, you have all these muscles like up in your hip and your upper thigh, like the quads and the hamstrings that you're talking about. But then it connects kind of, it's the lateral edge of your tibia, right? So like,
Yep, it kind of like has like fascial connection to like even fibular head too. So it kind of does this funky thing.
but it's safe to say that there's not a lot of muscular connection. So we could say that that like more distal edge going down the leg by the knee is going to be the anchor. So you're not really playing tug of war with two sides of people. You're like playing tug of war like against a brick wall, So like, what you do is you don't go to that tight rope and like massage it with your percussion gun and like give it a rub down and say, like, come on, rope, like, give me some length, like, please don't be so tight. You go to the end that's pulling and you say, like, come on, guys, like, give me length, give me some slack. And in this case, it's going to not the IT itself, but then the things that are pulling on it, like all those muscle groups that you were talking about before.
Well, that's like, well, you've rolled out your IT band before with the foam roller.
Mm-hmm. Oh,
And
it's the one people come into the clinic and they're like, yeah, like, I have IT band pain. I take the palm of my hand and I just gently get them on their side and just push my hand from their hips all the way down to their knee. And just even with the lightest amount of pressure, you just see people's faces light up like, oh my God. And it's the same feeling I have when I'm on a foam roller and my IT band is flared up. The last time this happened to me was the middle of summer, thank God. But it is probably the worst thing that anybody can feel in a foam roller, honestly.
Like, ugh.
Decrease that pain is to just like sit in the pain cave on the foam roller for 5 minutes, you know. When quite honestly, when people stretch and they foam roll their hips, they get that same level of deep, like, ooh, whoa, like I can tell that that's really tight. And then that usually, you know, like somewhat like, I don't want to say tangentially or, you know, like inadvertently, because it all connects, but we're giving tension on those pain spots along the IT band, or we're giving length to those areas, and then they stop hurting, you know?
Yeah.
So then we could also say that, like, well, why are those muscles like getting tight and getting like sore in the first place? Like, what's the root cause? How do we prevent those muscles from getting overused then?
Well, and I think it kind of goes back to what we were talking about even in the beginning, right? Making sure that the quads can do their job, making sure the hamstring and that they're all able to function under tension, which is a great segue into like wrapping everything up, is that everything you have to train that tissue in how you want it to perform. And if it's running, which is what we're talking about, it has to be adaptable, and then looking at the mechanics of everything. And I mean, I'm sure as like, again, movement specialists, like you know that, and but it's hard to sometimes have people understand.
I love that. That is a perfect wrap up to describe everything that we've been talking today, whether it's, you know, your hamstrings, your plantar fasciitis, quad soreness, IT band, is training status. Like taking a look at like does your training look like? Are we doing too much, too fast, too soon? Are we doing the strength work? Are we doing the mobility work? How can we alter our plan, whether it's scaling back on miles or whether it's scaling up on things like strength, that can help me be a better performer, you know?
100%.
I feel like oftentimes I feel a lot of our athletes try to skimp on the mobility and strength, and it catches up with us, right? So try to stay up with that. I'm just going to do a little plug for our coaching business, Ornery Mule Run Coaching. We have an exercise library, which you can find on trailrun.coach. And we also have some really great running packages. We actually just released a brand new one yesterday. So our first current coaching plan, we're really looking at holistically, how can we support runners? And we know we need to look at the whole runner, right? We need to look at their mind, their body, their everything that encompasses that. So we have a plan where you would start out with an initial virtual consult with Dr. Liesle Elsey. She's going to help doing a quick screen of your movement to see where your weaknesses are, and then able to incorporate that into your training plan on final surge with your coach to look at mobility and strength needs that you may have to keep you injury free, or if you are experiencing injury when you come in, help resolve that and make you stronger so that you're not struggling with injuries. I think that's super important with runners. I think running gets deemed as the most injury sport out there, right? Well, because when we think about running, it's often not been a common practice to really focus on strength and mobility. Other sports, that's where it's at. So we need to, kind of be focusing on that as well as, other sports like basketball or baseball or football, right? We still need to be strong as runners to be able to be injury free. And then our newest package also adds in a assessment with our dietitians, a nutrition assessment, which is another huge piece in keeping us healthy. When we talk about all of the things we've talked about today, also what we're eating, what we're putting in our body and fueling with is going to help us with preventing some of that injury and make us stronger and keep us healthy as athletes. So if you have any questions, you can reach out to me, loretta.ornerymuleracing@gmail.com, and I would be happy to talk to you about our coaching services. So I knew this was going to be a great show. I'm surrounded by greatness here, so I'm super excited for this. So thanks, Reese and Liesle, for having this conversation. I'm sure we're going to be able to bring you back on the show because we can have a lot more conversations that I think is super valuable to our running community. So thank you.
Thank you for having me. This is a lot of fun. I love the nerdiness of it.
I knew 2 nerds in one room, okay, maybe 3, would do really great.
Thank you so much for meeting with us this morning, and Coach Loretta, thank you for connecting all of us. Dr. Liesle, appreciate all of the insight and all of the words of wisdom that you had for us today. I love talking about this stuff, so it was honestly, the pleasure is all mine today.
Agreed.
All right. Thanks, everyone. We'll see you next week, and we're going to be bringing on Coach Madeline Harms next week. Bye.
Take care.
Bye.